It wasn't even a thought that we would be dealing with this catastrophe.
Lauren Barmash-Viator's entire family contracted COVID-19. Her father died, her mother needs help breathing, and she continues to suffer from long-haul symptoms.
This was the variant, so it hit us very hard and very fast.
The COVID-19 virus is trying to bring Ontario's hospitals to their knees.
Late Friday, the province added 2 emergency orders, allowing hospitals to transfer patients elsewhere without their consent, and non-hospital healthcare staff can be redeployed to hospitals.
It's so strange and frightening to see otherwise healthy young people, but they are being admitted because this virus is cutting them down.
Dr. Brooks Follis is one of those physicians. Working in a COVID-19 hotspot, he says he sees the worst of it and expects ICU numbers could double in the coming weeks.
If you get the new variant, you're more likely to be admitted to hospital regardless of your age. You're more likely to require an ICU regardless of your age, and you're more likely to die regardless of your age.
Some doctors are making a plea to the government to consider allowing healthcare workers from other provinces to help.
I would think the provinces will want to work with one another to find these solutions.
This Toronto Children's Hospital is adding 8 adult beds for COVID-19 patients. That's never been done before.
It is a bit unprecedented for us at Sick Kids too that we had to become part of a support for healthcare systems crisis like this. I am also afraid that it will get a little bit worse before it's going to get better.
A troubling prospect for those seeing the current reality up close now.
This never should have happened. And I don't know why it did. I don't know how it did. All I know is that it did. And it did to my parents.
So, Talia, you're at Sick Kids Hospital, which is taking adult COVID patients. What kind of impact is that having?
Well, the president of Ontario's Hospital Association says he applauds Sick Kids for putting up their hand and saying that they want to be part of this fight. But the 8 emergency ICU beds here, meant to care for younger adults with COVID-19, are already nearly full. Ian?
All right, Talia, thank you. For more on this, let's bring in Dr. Isaac Bogosh. Dr. Bogosh is part of Ontario's Vaccine Distribution Task Force and an infectious diseases specialist in Toronto. And what do you expect to see in Ontario ICUs in the next few weeks?
Yeah, sadly, I think things are going to get worse. We see growing case counts. We haven't yet realized any of the benefits of the lockdown measures that were only enacted a few days ago. It's going to take at least a couple of weeks before we see any benefit from that. So sadly, we're going to see larger growing case numbers per day, and sadly, more people admitted to the ICUs in an already stretched beyond capacity healthcare system.
So sad, as you say, inevitable to an extent, because this is reflecting infections that happened weeks ago. What should we be doing right now, though, to slow the spread?
In all fairness, this is going to be a lot of policy, right? We need sound policy to really ensure that we can curb transmission in all parts of Ontario. We also need support for essential workers that just don't have that luxury of locking down or staying home. And finally, we need to vaccinate like stink and get vaccines into those high-burden communities, into those workplaces, and into the arms of individuals who are, unfortunately at significant risk of getting this infection.
Dr. Bogosh, thank you.
My pleasure.